Bismillahirrahmanirrahim. Today we will discuss the different scenarios. All these scenarios about the infections. So the first scenario is 25 years old poultry farm worker is brought with inability to open his mouth for the last 3 days. He had injury on his right foot 10 days ago but kept working barefooted in the farm without treatment. So this is the one of the young man scenario. He is working in the poultry farm and he has a injury on the foot, that is the barefooted. So what is the diagnosis on the high index of suspicion? So there are certain buzzwords which are important. One of the buzzword as he has a injury on the right foot, injury on the right foot for the 10 days ago, and he neglected that injury, so some infection has got a person. So on this suspicion, so what may be the diagnosis? We will discuss in detail what is the diagnosis on the high index of suspicions. You are thinking about what is the diagnosis? It most probably it is the tetanus. Then if the diagnosis is tetanus, then we have to outline the management plan with the prognosis. So this question has two parts. One is the management plan with prognosis, and you have to write down the about the management and as well as the prognosis. So here is the key of this question, as we are suspecting it is the tetanus. So this tetanus is different from the tetany. Tetanus is an infectious disease and tetany is the metabolic disease due to the hypocalcemia. Here we are concerned with the organisms. So the Clostridium tetani that causing this problem. So regarding the management plan, the first most important thing is the isolation of the patient. So all these patients should be isolated, kept in the a dark room where there is no noise is present, because this just stimulation of the noise and the light can give a more fits to the patient. So that's why there are certain dark rooms they are made for such patient uh, which have got a tetanus. So it means the quietness there, the comfort should be there, and the drainage of the pus and wound. If there is a remaining wound you find, so that the wound toileting will be needed. Drainage, incision and drainage, and remove the pus and irrigate with the normal saline or the hydrogen peroxide. So this is a very important aspect in the management of the patient. You have to remove the source and dilute the organisms which are present in that area. And the second important thing is the human anti-tetanus globulin is given intramuscularly to limit the effect of free toxins and should be used in the dose of 25 to 500. So you should remember the dose. If you don't remember the dose, it's okay. So the most important, and what type of this immunity? These are the immunoglobulins. These are the immunoglobulins which are present, which can dilute this area. And throughout this period, they establish the active immunity by giving the toxoids. So it means this the human anti-tetanus globulin is the passive immunity. Already the antibodies are present there. It will dilute the toxins, and the other is you have to give the active immunity by giving the toxides. So this is important if the according to the age of the patient, whether he has taken initially this toxide in his activation immune in their vaccination programs. So in the old age, if the patient is a young age, he might have not taken this toxide, so you have to give toxide. The seriously ill patient with dysphagia and reflux. So this is the seriousness of the patient. It can becomes dysphagic, and reflex spasm will need to have a nasogastric tube passed and give the sedation. So sedation is most of the important. The diet, the need for the intravenous nutrition in such patients, the maintenance of the balanced protein intake, and the renal function and the cardiac function will be priorities. A tracheostomy should be considered if the patient has any difficulty in breathing. Sometimes these patient needs airway maintenance, and they have a problem with the airway, and you have to perform tracheostomy. First they are put on the ventilator, and later on the tracheostomy front, because the more duration is needed for the intubation of these patients. And when you have given the tracheostomy, then the meticulous care of the tracheostomy tube indicates the suction and the humidification. These are very two important factors of the care of the tracheostomy, because when the patient is put on the tracheostomy, you have to manage the tracheostomy. So in this scenario, in the management, there are different segments you have to consider for the management of these patients. So the prognosis is poor. 30 to 40% mortality in moderate to severe diseases can occur. So this is the whole scenario about the tetanus disease, and it is a common if there is no patient is having toxide, the vaccination active vaccination is not given, then first you have to give the passive uh, immunity, and then you give the immunity. So this is one of the important scenario about the infections.